Hello everyone, this is Dr. Hani. I'm a consultant psychiatrist at Synapse Clinic, Ludhiana, Punjab. What prompted me today to make this video is the fact that to a common man, a lot of psychiatric issues and illnesses, they're labeled as tension or depression because this is the most familiar term in the society. But there are a lot of psychiatric illnesses and issues which are much less talked about and very less treated. One such entity is bipolar affective disorder. What do we mean by bipolar affective disorder? Bipolar stands for two poles. One pole is depression, many people are familiar with it, stands for low, and mania is the other pole, stands for high. So, depression is characterized by low mood, tiring out very easily, and a general sense of loss of interest in day to day activities. A person with depression can have minor symptoms as well, such as intense anxiety, a lot of negative views towards life, and lack of confidence, impaired memory, focus, concentration, and if not managed correctly, this can also lead to suicidal ideation and suicidal planning, which is very sad. The other pole, mania, that is characterized by, it is quite opposite of depression actually. So it is characterized by increased activity levels, increased energy levels. There is either a very high mood that is characterized by singing and dancing, or there could be very irritable mood which can lead to a lot of property damage and harm to those around the patient. The other symptoms of mania also include impulsive decision making, reckless behavior such as rash driving, a lot of aggression on the part of the patient. There is overspending, spending excessive amount of money. There is over familiarity even with the strangers, like the person will go and just start talking to anybody even if he doesn't know the person. There's a lot of big talks, or also called as grandiosity, in the patient. So all these symptoms, they comprise the characteristic picture of mania. Like I said, the person can be extremely happy or the person can be extremely irritable. So these are the general symptoms of bipolar affective disorder. It often comes in episodes, and one episode will be having depressive symptoms, or one episode can also have manic symptoms. Or in between the episodes, the person can be with completely normal mood. One very common question that is asked in outpatient departments is why our patient? Why this person is suffering from bipolar affective disorder? So there is no single cause. BPAD is a multifactorial condition. So it is often a combination of genetic loading. There could be genetic causes. There could be neurological changes in the brain that could be present at the time of birth or can be developed later in life. Also, environmental stresses. So the combination of all these factors can actually precipitate an episode. Another important thing that I want to mention here is that patients themselves, they get to know about the pattern of their episodes after a while. And same thing goes for caregivers as well. Family members, they also get to know the pattern of the episodes of their patient. So it is very important to actually be aware about the symptoms and actually be aware about the pattern of the disease. Now that we covered all the basic information about the symptoms, let's talk about the treatment part. How do we treat BPAD? This is the normal mood of the person. Depression is characterized by a dip in the mood, and mania is quite the opposite, like I said. So it is characterized by the elevation of the mood. So a person with BPAD is often experiencing highs and lows, highs and lows. A mental health professional, yes, you guessed it very right, a mental health professional is often going to hook you up with a stabilizer so that your mood doesn't go low, mood doesn't go high. That stabilizer is called a mood stabilizer. There are a lot of mood stabilizers in the market. So they can actually start lithium or divalproate, or they can choose out of other mood stabilizers that are available for this condition. Your mental health professional is going to pick the mood stabilizer according to your profile, including your metabolic parameters, the symptoms of your illness, whether or not you're taking alcohol and other substances, and multiple other factors like your family history. All these parameters are taken in account while choosing a mood stabilizer. Other medications that can be included include sedatives for impaired sleep and intense anxiety and aggression. Next is antipsychotics. If the symptoms of mania or if the symptoms of depression they are associated with psychotic symptoms such as delusions and hallucinations like self-muttering or talking to self and gesturing to self, smiling to self, all these symptoms they can be cured properly with antipsychotics. Other medication that can be a part of your management plan is antidepressants if the patient is experiencing a depressive phase. But the antidepressant will be given obviously under the cover of mood stabilizer. So as you are aware now about the basic information of the symptoms, about the basics of the treatment and how to approach this illness, there is no need to actually lose hope. Because with regular compliance of the medication, taking proper guidance from your mental health professional and maintaining some lifestyle modifications, the prognosis of the BPAD is really good, and there is no need to actually panic, or there is no need to think that this can not be cured by the medication. Patient's compliance plays a huge role in the treatment part. So now we have covered a lot about BPAD and the treatment process. So stay positive and stay tuned for more psychiatric updates. Thank you so much.